Good day. Hello, everyone. This is Wei speaking from Taiwan. And today I will talk about a topic is how to choose blood glucose monitoring system and notice for monitoring and managing blood glucose. And diabetes is a major health issue that has reached alarm level. Today, nearly half a billion people are living with diabetes worldwide. First point is 1 in 11 adults has diabetes. Second, over 3 in 4 people with diabetes live in low and middle income countries. Third, 10% of global health expenditure is spent on diabetes. Diabetes is more and more serious in the world, and the number has significant differences between the 2017 and the 2019. If the current trends continue, 700 million adults will have diabetes by 2045. The largest increase will take place where economies are moving from low to middle income status. And in Caribbean region, the prevalence rate of diabetes is 13.3% in 2019 and 14.2% in 2030. Let me talk about how to choose a blood glucose monitoring system. Blood glucose meters are small, computerized device that measure and display your blood glucose level. These devices are helpful for people with diabetes. If you have a diabetes, monitoring your blood glucose level provides you and your doctor with valuable information about how food, exercise, medication, stress, and other factors may affect your blood glucose. This information will help you and your doctor construct a treatment plan tailored to your needs. Many types of blood glucose meters are available for at-home use. This range from the basic model that only reads blood glucose level to more advanced version that over features such as memory for storing information. The cost of blood glucose meter and the testing supplies varies, and your insurance may not always provide coverage. So study all options before picking out a meter. And the following slide will tell you about the tips and the tricks. Okay, you must check the following points. First is a manufacturer capability and the certificates. The second is a glucose meter certification. One point is to guarantee an accurate measurement results. This is smart to choose the meter that is ISO 15197 certificates and the TÜV or other also related party audit. And the second, to check the meter if it have a CE or FDA certificates. And the third, peer review for accuracy, precision. The check is also very important. And the fourth, other checking points. I take our one model, GM550, as an example for demonstration. The first is ease of use because testing procedure vary for each meter. Some require more work than others. So, for instance, how much blood does the test strip require? Can you easily read the number on the screen? And the strip is easily inserted into the meter port. And the second is easy to maintain. It is simple to clean, it is quick and easy to calibrate when you get new strip, or that it require calibration or not. Third is a specification. You need to check the user menu, something else to check the spec is your requirement. And the fourth, the enzyme used to measure glucose. And the fifth, how smart the test strip. This is also very important. Request the manufacturer capability and the certificates, such as ISO 13485 or C and the GMP. If the manufacturer develops digital diabetes monitoring system, you also request ISO 27001, HIPAA or GDPR certification and the certificates. Bioline certificates, quality management system, EN ISO 13485, just update, and the effective date is from this year to 2023. Also to check the meter if I have a FDA or CE certificates. And the ISO 15197 specify requirement for the in vitro glucose monitoring system that's measure glucose concentration in capillary blood sample for specific design verification procedure and for the validation of performance by the intended user, and is applicable to manufacture of such a system and those other organizations. So you need to know and understand the ISO 15197 international standard, such as accuracy criteria. This is very important. Third-party institutes for diabetes. This third-party name is Institute for Diabetes Technology. Is the acute clinical accuracy trial of 18 glucose meter collect from the pharmacy in EU, but only 3 meter can meet the 1010 accuracy over ISO standard, and the Bioline meter is 103. Other published journals, including the biosensor, strip fabrication, auto-coding mechanism, and the accuracy precision, summarized and collected by Journal Spotlight. There are many providers of blood glucose monitoring system, but I take the Rightest GM550 as an example to remind you of the other points, choosing the right one. And please check the specific demonstration, including the HCT range, measuring range, and the memory capacity from user manual or instruction. Each glucose meter uses enzymes, which are often on the test strip, to measure your glucose value. The enzyme reacts on the blood and therefore makes the calculation possible. So it is important to choose a meter that uses the right enzyme. After all, this increases the reliability of the measurement. For example, there are meters that measures on the basis of the GDH-PQQ enzyme. This enzyme tends to include other sugar, such as maltose, lactose, and ribose in this calculation. It can lead to an incorrect value. So, what kind of enzyme for the glucose testing is very important because of different enzymes are of different characteristics. So the comparison table is for your reference. Ease of use through whole process is very important, including insert, apply, test, and remove. I suggest you can try and operate it before purchasing. Autocall is one of the main factors if the meter is easy of use and accuracy and precision. So, Bioline autocall, I mean, is a true call through calibration, and this is why our quality can compete against AccuCheck. The autocall module is durable for more than 100,000 strip insertion. The reagent used in making testing strip will vary in different production batch. Different production batch have a different variation. At the same time, blood glucose concentration, the glucose meter will be receiving different measurement of a signal current. So since this different current actually mean the same glucose level, manufacturer need to calibrate the batch and be coded into the meter. Then the meter will be able to function correctly. This is why calibration is very important. Comparison of each coating technique. Auto code is more easy of use and accurate than chip or manual coding. Okay. Our strip technology is from the modified YSI technology. YSI is an instrument for the plasma glucose test. And simple fabrication, but stable, low resistance, and ductile, and plus around barrel printing electrode. Enhance experience, easy to hold, reliable to use, and safe to test. And easy to hold, the bump dots design allow people with low sensitivity on their fingers and people with impaired vision to easily identify the back and forth of the strip. And reliable to use, the integrally formed strips prevent bending and the wires design reduce the possible inaccuracy. And safe to use, the sign insert the test strip allow operator to avoid contact with blood sample while testing. Not only meter have an auto code module, the code key is incorporated into the test strip. Overall, auto code technology is more easy of use and more accurate, precise, and reliable. Next session, let's talk about notice for monitoring and managing blood glucose. First, what is diabetes? Diabetes is a long-term condition that occurs when the body cannot produce any or enough insulin or cannot effectively use the insulin is produced. The main category of diabetes are type 1, type 2, and gestational diabetes mellitus. Most people with diabetes does not display significant symptoms of hyperglycemia until your blood sugar rise extremely high. If you have the symptom of the dry mouth, increased thirst, frequent urination, please consult your doctor immediately and check your blood glucose. Risk factors for type 2 diabetes, including the overweight, obesity, hypertension, or GDM history. This is estimated that up to 17% of people with prediabetes go on to develop type 2 diabetes. Fortunately, progressing from the prediabetes to diabetes isn't inevitable. Prevent or delay getting type 2 diabetes is very important. So please regularly test, monitor, and track your blood glucose. Why should we worry about diabetes? Because high blood glucose level may cause damage to blood vessel, the heart, kidney, and the eyes. And diabetes may also increase the risk of leg amputation due to infected long-healing foot ulcer. How does glucose work in your body? After eating, food is mostly turned into glucose. The body is the main source of energy. And blood glucose in healthy people. In people without diabetes, glucose stays in the healthy range because insulin is released at the right time and in the right amount. Insulin helps glucose enter the cell. This is the blood glucose in healthy people. Why hyperglycemia. This means the high blood glucose. If people with diabetes, the blood glucose builds up for several possible reasons. First, too little insulin is made. Second, cells cannot use insulin well. Third, liver releases too much glucose. This is why hyperglycemia if people with diabetes. How is diabetes diagnosed? So you need to check your blood glucose and to confirm if you have diabetes. There are several ways to diagnose diabetes. Each method is usually repeated on the second day for proper diagnosis. Testing should be carried out in a healthy care setting, such as your doctor office or lab. Below the table is the guideline from the ADA to caregiver or if you have a potential to become the diabetes or now you are in pre-diabetes. So monitoring blood glucose is becoming very important if you have a pre-diabetes or you are in diabetes. So safe monitoring of glucose is a critical element in diabetes management. So patient self-monitoring of blood glucose is available to healthcare provider and the patient to assess the effectiveness and the safety of a management plan on glycemic control. So safety and effectiveness is very, very important and can be done by test your blood glucose regularly by meter. How often should the patient test their blood glucose? You can see below the table listed from the ADA guideline or an ACE and separate type 1 and type 2. So you can check if you are type 1 or type 2. You have a different how often you need to test your blood glucose. But anyway, you need to consult your doctor or health caregiver to get you know how to test because there's a complicated method to managing and your glucose. Benefits of testing blood glucose. The first, you can adjust your diet. If you intake the high sugar or food, you can adjust and you can do more activity and medication because some medication have a turn into the maltose or lactose into your body. So you need to check if it affects your blood glucose. The second, you need to understand the other factors that affect blood sugar level. And the third, you can identify blood sugar level that are dangerous, high or low, and how well you are achieving your goal. Diabetes is a complex disease, but it doesn't have to be. New option is a digital health technology for diabetes management. So this means you can combine your logbook and say hello to Rightest Care app by your mobile phone and know any writing, any data in your log. I just take our GN700SB Bluetooth example plus our app for your reference. This is another option that you easy to manage your diabetes with your caregiver team. This is our app. You can see our future. Our care app provides user with a business solution for personal diabetes management. It helps you to easily keep your blood glucose fully on track at your fingertip. So you can go to the market, also consult your doctor or pharmacist to buy the Bluetooth meter or NFC meter or 3G meter and can use a mobile phone connect with your data, with your caregiver team, and let's more integrated your data pattern and to get the personalized care service. This is our app. Our app can explore the intuitive interface. One, archive your routine. First, record daily activity tasks, including exercise, and take food picture notes can upload on our app and share with your family, your caregiver team. Choose what kind of food you intake and what kind of food affects your blood glucose. Second future point is we can create personalized timetable. You can set your glucose target range for each meal. Second, you can schedule customized testing reminder because our app can automatically pop up in your smartphone to remind you need to test your blood glucose. And the third, differentiate weekdays, weekend testing periods. And the third function point is learn diabetes knowledge. This is also very important. You need to review usable diabetes knowledge and study diabetes data information. You can guys from our app. Okay, this is our Rightest Care total solution. You can use the Bluetooth meter and use the app and install on your mobile phone, and also very easy, no time lag to discuss with your caregiver team. So this is a new option, new technology that you test, manage, track your blood glucose more easy, more comfortable, more confidence. Okay, this is my overall the topic. Thank you.